On this day, with several big news developments, including the aftermath of another police killing in Minnesota and President Biden's announcement of when U.S. troops will leave Afghanistan, we begin with the COVID story. A number of vaccination centers have begun suspending the use of the Johnson & Johnson vaccine after federal health officials recommended the move. The Centers for Disease Control and the FDA said today that they are reviewing extremely rare and severe blood clots in 6 women. That is out of nearly 7 million people who have received the vaccine in the U.S. Dr. Anne Schuchat is the Principal Deputy Director of the CDC, and she joins us now. And for the record, Johnson & Johnson is a NewsHour funder. Dr. Schuchat, welcome back to the NewsHour. What can you tell us about these blood clots and how dangerous they are?
Thank you, Judy. We're taking this very seriously. As you said, almost 7 million doses of the J&J vaccine have been administered in the United States. And right now, we have 6 reports of serious blood clots, including 1 fatality, unfortunately. There's an unusual pattern to the blood clots in that there's a very low platelet count in addition to the clotting event. And that unusual pattern tipped us off that we really needed to take this seriously. We've recommended a pause for 3 reasons, because we wanted to give the healthcare community time to learn how to recognize, diagnose, and manage this condition. Because if you treat this condition with the usual treatment for clotting, it can get worse. So that was a critical reason to get the word out. The second one was to urge more reporting so we could get a better understanding of the pattern and whether this is limited to women, certain ages, or just how frequent it is. And then the third reason for the pause was to give time for our advisory committee on immunization practices, our group of independent scientific experts, to review the data carefully and give us their advice. And that meeting will be happening tomorrow.
Dr. Schuchat, is it certain that there are not only, but there are 6 women and there are no more people who've developed these clots?
We don't know that yet. We are actively urging reporting, both by clinicians and by patients or their families, through the Vaccine Adverse Event Reporting System, VAERS, which is how we detected these cases. So we are very interested in understanding whether there are additional cases or possible cases, and it takes a bit of time to validate, to review the records, and so forth. These are a rare set of symptoms, not the usual kind of blood clots or strokes that people see, and it's unusual enough that we really want to get to the bottom of it.
And I'm asking about the number because sometimes the reporting may be delayed, and 6 out of 7 million is such a small number. I think people want to be reassured that it is that small.
Yeah, that's right. This is an extremely rare event that we're tracking right now, but because the usual treatment for people presenting with this rare event is different than what clinicians might think of, we wanted to take a pause and give time for clinicians to get up to speed on this. In fact, we'll be doing a call for a broad group of clinicians on Thursday to try to help them learn how to recognize, manage, and respond. But you're right, this is extremely rare right now based on what we know, and we have to learn more. But I just want to say how important it is to the CDC, the FDA, and the federal government for us to take vaccine safety seriously. We know that we are vaccinating on average of over 3 million people a day, mostly with the Moderna and Pfizer vaccines. And those vaccines are proving to be very safe and effective. And we haven't seen this problem of the low platelet count and the blood clots with those other 2 vaccines. But with this J&J vaccine, we want to keep our eye on it and have this pause while we take time to learn about whether there are more cases and whether they really are linked to the vaccine.
We know there was investigation, there was a lengthy process before the FDA approved the J&J vaccine for emergency authorized use. Why wasn't this discovered then?
There are a couple things to say. First off, when we have retrospectively looked back at the clinical trials, there was one episode of an event that looks a lot like this. It was actually in a man. And at the time, a single episode, it's very difficult to understand what that might be. But of course, we've been actively monitoring the safety as the vaccines get given out more broadly. But you can imagine when you have an event that might be as rare as 1 in a million, that may not show up in a clinical trial, even as large as the trials were before the FDA authorization. And that's why we take very seriously monitoring safety as well as effectiveness after vaccines go into large-scale use, because you really can't detect something very rare in vaccine trials, even with 50 or 60,000 patients.
And finally, how long do you think this pause may last, and what's the effect on the availability of vaccines overall to Americans?
Well, the good news is that there's a supply of the Pfizer and Moderna vaccines, and we expect not to see a challenge with supply in the short-term future based on this. In fact, we're expecting 28 million doses of those other two vaccines for this next week. I can't say exactly how long the pause will go on. I can say that we're working very quickly to get as much information as we can, and we're holding that first advisory committee on immunization practices emergency meeting tomorrow. We'll know more after that. And I commit that we're going to get back and update the American public about this as we know more.
Well, I know everybody's paying very close attention. Dr. Anne Schuchat, who is the Principal Deputy Director of the CDC. Dr. Schuchat, thank you very much.
My pleasure, Judy.